Patient identification means a lot to me because it's absolutely critical as part of the pharmacist's role and also pharmacy assistant's role, because we need to ensure that the patient that we're dispensing for, the patient we're reviewing, the patient that we're counselling, we need to make sure that that's the person that the right medication is getting to and that we can identify them appropriately. As we know, medications, and a lot of them are high risk, and if they get to the wrong patient, then it can have adverse consequences for them. So it's vitally important that we identify the patient appropriately to ensure that the right medication is getting to them. The role of the pharmacist and the role of the pharmacy assistant. How we identify patients, we identify them through the emergency department, we identify them on the ward, we identify them in the outpatient dispensary. And the reason why we identify them is to take best possible medication histories, to review their medication on the ward and ensure that it's the right medication, right dose, etc. for that particular patient. But also when we receive a prescription in the outpatient setting, to ensure that the prescription that we receive is for that right patient and that the medications that we dispense get to the right patient. So when we approach a patient, we need to make sure that we're checking their name, getting them to repeat their name to you just to make sure that they haven't swapped beds or it's a carer or someone that's actually there. Ensure that we're checking the armband, flag if there's no armband on there and check the reasons why there's no armband on there. Check their date of birth if they're also able to tell you that, and also other pieces of information that you have accessible like the medication chart, and ensure that you validate that and check and cross-check and keep on checking to make sure that that person is the correct person. Yeah, so the recommendations that I'd have to my colleagues and also to the staff is to ensure that the patient that's in front of you, that you're reviewing, that you're talking to, is the correct person. So you need to ensure that you check their name, date of birth, use other elements as well, such as their address, just to ensure that you can be confident that the person you're speaking to or reviewing is the person that you expect.